Ciao mondo, hello world, hola mundo, hello monde, konnichiwa for our Japanese friends, and ni hao for Chinese friends. We are here today in Munich, and I have Professor Kellum as a master of ceremony for a special cappuccino on a kind of consensus, controversial discussion on the application and moving forward with AKI and the use of biomarkers. So John, what happened exactly today and possibly in the few weeks before?
Well, some time ago, actually, we had a meeting in San Diego. I guess, Lou, when was that exactly?
April.
In April, back in April, Dr. Guzzi and I chaired a session in San Diego where we had a group of experts, but different kind of experts, not experts so much like you and I, but experts who actually take care of patients every day, not just every other day.
Okay.
And these people actually told us how they used the test, the NEPHROCHECK test, to reduce AKI. And
may I just remind that in the continuum of AKI, today we have the possibility to have an early detection of kidney stress and possibly identify patients that move forward towards AKI. So it is crucial to know that this test is available today compared to the past. It does not substitute creatinine, but it is simply something that goes much before creatinine rise in the history of AKI. Sorry, I interrupted you.
Oh, no problem, because that's exactly what we spoke about, was this idea that by using the test to detect stress, that we can actually do things that reduce the rate of AKI. And Lou, you have done this now for a few years in Orlando, and you relayed your experience with the group. What was that like?
Especially for our Italian friends, what is called Lu Guzzi in Italian sounds like Luigi Michelangelo Guzzi. Just to state your Italian origin, please go ahead.
So we did it in Orlando. We have an elderly population, as you know, and we have a lot of patients with AKI, sepsis, shock, etc. We instituted in one of our larger community hospitals the process of making NEPHROCHECK, as Claudio well described it, an early detector of renal insufficiency, part of our process for septic shock patients, for post-CABG patients, and for patients who are getting nephrotoxins. And in a community center or a community engaged process where you can change somebody's risk of renal failure, it's absolutely huge, obviously. It's huge because you change their whole lifestyle. And our success rate is bordering on, I think what most people say, 30 to 40% turnaround in people we didn't even know may have had renal insufficiency and failure. And just like you found, John, sometimes you get fooled. I mean, you've got the wealth of experience. Claudio's got more than you and I combined in age and experience. But the reality is that that experience is huge. And we sometimes can't guess, even with all this experience and all this knowledge, who has AKI.
No, that's exactly right. And in fact, what was interesting today was we came to Munich, and we thought we were in San Diego because we heard the same thing from all of our European colleagues, the same exact problems that we had discussed with our American colleagues. And once again, we've discovered that the world is actually a much smaller place than we realized.
So John, is it true that the myth of inevitability of AKI is now dismissed?
I certainly feel that it is, that we have this opportunity to do something about AKI. And I think for all of you listening at home, I think you should be asking yourself, what did I do this week to reduce AKI in my patients?
So at the end of the story, what are our friends going to see in the next weeks or months? What is the next step of this fantastic group that joined here?
Well, so look for a publication that's a bit different than the usual scientific publication. A publication that's actually focused on describing what really happens in the real world. And we'll hope to have that out to a journal near you sometime soon.
Okay, fantastic. So basically, there is a lot going on in AKI, but everyone in a small hospital, in a big hospital, in different disciplines, can be a real actor in reducing AKI and the consequences. So follow us. We will do a little more cappuccinos in the future, but for the moment, thank you very much for joining today Cappuccino from Munich. Excellent.